Hi, my name is Steve Bullich. I'm 62 years old. I had a 5-way bypass operation and an aortic valve replacement and a 9-hour surgery. I was in the hospital for 8 days and spent about 4 months recovering afterwards. You are just about ready to embark on the wildest ride of your life. That being said, you need to know a few things. Doctors don't tell you very much about heart surgery. They'll prepare you for all sorts of things, all sorts of operations and different things, and they give you a lot of information, and there's very little information that you will be given about your heart surgery unless you just bother them and bother them and bother them. The more that you understand about what's going to happen to you, the better off you're going to be in the hospital, the better off you're going to be after you get home, and the better the prognosis, meaning the long-term recovery that you can expect. I've had heart problems since 1995. That's 17 years now, so I know what I'm talking about. I've had all sorts of surgeries. I've had major angiograms, angioplasties, the major 8-hour, 8-inch or 12-inch zipper cut. I won't show you my scar, they're all the same. I was recently in the hospital and diagnosed with a rare form of angina called Prinzmetal variant angina, and we'll get into that later. But there's all sorts of heart problems that people can go in for: valve replacement, bypass surgery, ablation, pacemakers, all sorts of things. But a lot of the preparations and procedures and things that they do and the way that you prepare for it and deal with it are basically the same. I have a sister who is a living heart transplant patient. She was the first woman in the United States to have a left ventricular assist. My mother was a bypass patient. My sister had a bypass before her transplant. My brother is going through it now. So I know a little bit about this. I know enough to tell people what I did and what worked and what didn't. So read my blog, listen up, just follow along, write to me, email me, please take part in my survey, help me to help other people. I'm writing a book. When we get that book, that's going to be nice, because you can just give it to somebody and say, here, read this. Everybody's not computer savvy and don't always get to the computers like some people do. So we're working on it, and I want to make it better, and I'd like to ask your help to make it better. And just follow along each step. We're going to have a YouTube video that's going to tell us about that particular area: pre-surgery, post-surgery, diet, ICU, rehab, all sorts of things. There'll be a video there for people who don't like to read or have a problem reading, or who just rather listen to it. So good luck on your journey. Get ready for it. Do everything you can to prepare. Read the blog, study the stuff, arrange your house, and you're going to do good. There's a very high percentage of survival rate in this, up to 98%. So it's going to be a rough few days. I'm not going to lie to you about that. But you're going to get through it. So many people who have come out the other side and say, man, I feel so much better than I did. I couldn't make it from the car to the produce department without huffing and puffing, and a month after I had surgery, I was up in Utah at 9,000 feet looking for arrowheads. This is the kind of thing it can do for your life. It can restore your life. It can prolong your life. So good luck to you.